So good afternoon, and thank you, Judy, for inviting myself and my colleagues here for the World Congress and this important panel. I'm excited that there's a lot of diversity and mixture in the audience between people starting their career as students, as well as the more seasoned researchers and clinicians, as well as the folks that are in government. My name is Elisa Hilmi, and I am the Executive Director of Core Group. Feel free to write down my email address in case you need to contact me in the future. Okay. And Core Group, I'd like to tell you a little bit. I think we have 5 minutes to tell about our organization. So I'm going to tell you about a very big, important organization in about 5 minutes and 5 slides. So we'll try to do our best. Core Group is an international network membership organization that is celebrating 20 years today, this year. Our vision, as you can see, is where communities everywhere, where everyone can attain health and well-being. And our mission is to improve and expand community health practices for underserved populations, especially women and children. So that's why Core Group's presence here in the discussion of the global strategy is really vital. We're a membership organization, which means people actually belong to us, and we have currently over 100 members, and those include international non-governmental organizations, or INGOs, as well as academic institutions, foundations, individuals, professional societies, and private companies. And our email address is right there. Our website is right there, so feel free to put that on your list to look up. And Core Group emerged in 1997 when a group of health professionals and technical organizations, technical people involved in international organizations, they found value in knowledge sharing, learning, and bringing together their resources in this neutral platform of collaboration. And so for 20 years now, we have grown not only in our membership, but in some of the projects that we're involved in globally. CORE means the Community Health Network, and it advances community health-focused programming. Any of you can join the Community Health Network. You can go to our webpage, and it says how to get involved, and you can add your email to our listserv and then become part of this larger network, which includes thousands of individuals, civil society organizations, as well as researchers and professionals on our listservs. And the Community Health Network, they help in advancing the global strategy through systemizing and standardizing best practices, creating new tools together, and generating recommendations. They build the capacity of global health organizations and their in-country civil society partners. They also offer practical training and technical training for the global health workforce. And we foster partnership and collaborative action, and we have collaborated on multiple projects and programs throughout the world. We currently have the following working groups, which you also can become part of by adding your email to the listserv on our webpage. We have the Nutrition Working Group, Community-Centered Health System Strengthening, Monitoring and Evaluation, Social and Behavior Change, as well as the Reproductive, Maternal, Newborn, and Adolescent Health, and a Child Health Working Group that is separate. And the fabulous thing about these working groups, it involves people from all around the world, different organizations that lend their expertise and have dialogue via these listservs. And they have work plans every year where they collaborate on multiple projects. So some of the tools that have been used throughout the world are Essential Nutrition Action and Essential Hygiene Actions Framework, one on positive deviance. There's so many that are on our website. I invite you to go to the resources page and you can download some of these. Besides being a membership organization, Core Group is also involved in several programs and projects throughout the world. through our different partners. And some of those include the United States Agency in Development, or USAID-supported Maternal Child and Survival Program, otherwise known as MCSP, which exists in 24 countries. We're also part of the TOPS Food Security Network, the Resilience Analysis and Learning Project, which really looks at resilience measurement and learning, and the Core Group Polio Project, which is throughout in 7 countries. And right now, in like the minute I have left, I'd like to tell you about how Core Group really fosters civil society and NGO engagement. And one of the models that has been used throughout our long history is the secretariat model structure. As you can see, it involves a variety of partners from non-governmental organizations, civil society, Ministry of Health, faith-based organizations, donors, and they all work together in this neutral platform within the country. And some of the examples of how this model's been used is in our polio project through Ethiopia, India, Kenya, and some of the other countries that have been successful in eradicating polio. And that model has then, the strength of the civil society, government, and INGO relationship has then gone on to do other things and integrated other types of projects and issues within their work model. We also have child health and malaria secretariats that have worked in the countries above, as well as Zambia. And we've also worked to help curb the flu pandemic in Ethiopia, Egypt, and some of the other countries. And the value of that is multiple countries and multiple partners can immediately start working together on one issue with the same guidelines and then scale it up across countries. So I think that's about 5 minutes. There's a lot more to say. I look forward to the dialogue between us and to hear about my other colleagues' organizations. Thank you.